So our next speaker for today is Rajlakshmi Borthakur. A lot of you must have heard her in previous conferences for those who attended SASD and any other previous conferences. I'll tell you a little bit about what Raji is for those who don't know. So Rajlakshmi is a successful designer who has later turned into an entrepreneur. She's on a personal mission to create life-saving devices. She was inspired by her son's struggle with epilepsy, so she created a wearable device which is called TJay. It helps in predicting, detecting, and managing epileptic seizures. She has received recognition from the Prime Minister of India, Sri Narendra Modi, and have been named a Forbes, and have been named a Forbes Women Trailblazer, one of the 12 women transforming India by United Nations and Niti Aayog. She is also one of the top 5 global women entrepreneur by Axa Insurance, and she is one of the top 3 innovators in India, Intel and DST, which is by India government, and so on. All right. So today, Raji is going to talk about her first medical innovation. So please welcome Rajlakshmi Borthakur.
Hi, everybody. Thank you so much. That was a glowing introduction, and I'm feeling very embarrassed right now. And before I start, I have to say that I'm still a very struggling entrepreneur, and been working in this industry for some time now. And with whatever experience I have, I'm planning to share it with you, all of you today. And with that, I would like to start. But before I do that, I would like to thank the organizers for giving me this opportunity. And I would like to thank the audience for joining in. And I hope that at the end of the presentation, there is some amount of a takeaway that I could give to all of you. So I will share my screen. And the topic that's been assigned to me is my first medical innovation. And as Kujema mentioned, I am the CEO and founder of TJay, and I have been working in this company since 2016. And prior to starting my own company, I worked in different IT organizations, especially I was with Infosys for almost 9 years, and then with Ernst & Young, Sapient, and then for a very small stint at Virtusa before I decided to plunge into into creating my own company. And so when I started, I did not have a real, a real vision to start a company. In 2015-16, when I was working on my idea, my goal was not to create a very successful startup. At that time, the startup ecosystem was coming up in India. Modi ji had launched the Digital India entire campaign. But I was not looking at starting up. I was at that point in my life where I was very comfortable. I had a decent job. I had 2 children, and life was pretty settled. And at that point, after working for about 18 years, I definitely did not look at starting my own company. I was, very comfortable with whatever I was doing. But then in 2011, my son was born. And from the first day of his birth, he had epilepsy. And it remained unrecognized for a very long period of time. And his epileptic attacks were so severe that whenever he would have his attacks, we had to rush into the hospital between 20 to 40 minutes. And he had to be given emergency medications to stop his seizures. And he had been in coma 2 times during this period. And it was a very traumatic period for us. So on one hand, life was settled. On the other hand, at a personal level, our son was going through all these issues. So there was a bit of a dilemma that was seeping into our lives. And in the midst of this, starting a company definitely was not one of my priorities. So my son's epileptic seizures were so severe that he has become a special child today. He's not able to speak. He is not able to run, so he still gets minor seizures even now. But he's not like what you would typically call a normal boy. And I'm told, as parents, we are told over and over again by experts that had our son been diagnosed at the right point in time, he would have been a normal guy today, a normal 10-year-old boy today. Normal in the sense somebody who could speak, do things, had a career in front of him, and so on and so forth. So the effect of his seizures were very severe, and despite everything, we are very lucky that he's with us. And because of his struggles, the experience of being his caregiver, I was able to start this company. And the goal of this company was to make sure that other children and adults do not go through the suffering that my son have gone through, and they have a better shot at life. So that's how I started. So during the initial few years, my goal was not to start a company because it was fashionable to start a company at that point in time, to start a startup. Rather, I was motivated to do so because my son was going through a very debilitating disorder, and I was looking for a solution. The doctors were not able to come up with a solution. They were not sure what was going on with him, and there was a threat to his life. And as a mother, I thought that I had to do something. I had to do something to make sure that his life is safe. So that focus on safety finally became a mission, vision, and mission part. It became a part of our vision and mission. And where today, as a company, what we are trying to do is to make life-saving devices, specially directed towards the neurological and the mental health areas, where our goal is to make lives safer, one prediction at a time. So when I say one prediction at a time, I'm alluding to the capabilities of AI systems that could provide predictions and may stop the onset of a serious problem. So this notion of safety is something that's very important for me. And as an entrepreneur, but more than an entrepreneur, as a mother, as a caregiver, I strongly believe in making devices and products safe to use for the end consumers. And I believe that if it is not good enough for my family and for my loved ones, it's not good enough for anybody's family. So that's the kind of emphasis we put on safety and quality of our products. Now, coming to my son, so here he is, and here is another view of him. Now, why my son was going through such a bad, a bad experience with his epilepsy was because epilepsy is very difficult to diagnose, and the de facto medical device to identify epilepsy is EEG, electroencephalography, which is a big system, which is, and EEG is a procedure, not a procedure, it's a test that's done in hospitals. You need a battery of technicians to put all these devices, electrodes on the head. There needs to be a radiologist to interpret it, and the software and the device themselves have to be procured. So that is the state of the art today, where an individual has to be admitted to the hospital either for a long-term monitoring or a short-term monitoring, and it is incredibly uncomfortable, as you can figure out. So this is my son with all his head bandaged up with electrodes, and these are his wires coming out. and there is this bag that contains a small modem kind of a small device, and that device in turn was connected to a bigger device. So it's a very cumbersome thing. And but what's more important is that despite being hospitalized to do long-term monitoring, despite undergoing the pain of getting tied up with all these devices, the results of EEGs are not generally very conclusive. They are a point in time system, point in time device, and only if a person is undergoing a seizure or an epileptic attack at that point in time can an EEG pick it up. At other point in time, it would give a report that says everything is normal. So that would happen to my son all the time. It was very seldom that when he was in the throes of an epileptic attack, the recordings were done. Most of the times he would have his attacks at home. By the time we take him to the hospital, the EEG, the center would be closed, or the EEG equipment would not be there, and so on and so forth. So finally, by the time we would get his EEGs done, the biomarkers left by the seizures would have gone, and hence his report would come up as inconclusive. So here I was, where at home, our son was having a seizure, and a severe seizure that cannot be stopped at home, that for which he had to be rushed to a hospital, he had to be rushed to an ICU. And this is something that could happen at any given point in time without any sort of a warning. And during this 20 to 40 minutes that we had in our hand to save his life, anything could happen. So as a mother, that was the situation that I was in, and I was extremely frustrated. I was very scared, and I was desperately looking for a solution. And despite trying their level best, doctors were not able to identify what was really going on with my son. And that's when I thought that if the EEG, the only device that we are relying on, if that is a point-in-time device that could provide information only at home, only in the hospital, only when a person is undergoing this event, if only that is the thing that is available, then what is it that could be done to make sure that additional information could be picked up at home through some mechanism. Now, I am not a hardware engineer, and I had no clue about electronic systems. I did not know what they could pick up. So in my desperation to find out a solution for my son's problem, I started reading up. And I started reading up the hardware. I started reading up about sensors. I started reading up about body signals, about the different mechanisms of the human body. And slowly and steadily, I moved towards neuroscience, and I did all the studies on my own. So from 2012, my son was born in 2011, and 2011 was a period where I was absolutely ignorant about seizures. I had no idea about it. And by 2012 was when I started to do my research. I was desperately looking for a solution at that point in time. And from 2012 to 2015 is when I did all my studies. And by the end of 2015, I came up with a blueprint for a AI-based system, an IoT-based system for the prediction and detection of seizures. It was very theoretical, okay? It was all based on my very rudimentary knowledge that I was gathering about electronics, about AI systems, about IoT, and also about medical science. So as you can imagine, my knowledge was in no way perfect, and I was barely scratching the surface. But this zeal to come up with a solution was so high. This zeal to save that life of my son was so high that I decided to do something about it and came up finally with a blueprint of this seizure prediction device. So that's how I started. And when I was working on my solution, I figured out that if we could collect information from the human head, the electrical impulses that are generated to the head could travel to other parts of the human body. And is there a way to pick it up from any other part of the human body apart from the head? And could sensors do the trick? So that's how I started. And I figured that we could collect a lot of information from the hand. So when I started, I thought of making a glove with a lot of sensors embedded inside the glove that could pick up signals before some event even started, and then provide predictions to the caregivers or even to the end users, so that preventive measures could be taken. So that was what I sought out to do, and this is the image that you see on the screen is what I thought that I should be making. And as you can see, the 2 fingers are outside, and the rest of the 3 fingers are covered. And that's because the goal was to extract information from these 3 fingers, along with from the palm. And that's what the knowledge that I had acquired. That's what I understood, that this particular part of the hand could be used to collect the right kind of signals, complementary signals that could provide us similar information to that of an EEG, and hence that part needs to be covered. Well, lo and behold, as you know, I was no expert, and this is what I came up with. As you can see, this is not the prettiest thing in the world. This was just an idea. And everything was very, very raw. It was embarrassingly raw, but this was the start. So this is what I imagined, and this is what we ended up making. But later on, when I started the company, we were able to take the help of product designers who understood what I wanted to build and why I wanted to build things in a particular manner. And then they came up with this glove concept. So we worked with this organization called Bang Designs. You can look them up. They're very famous. So Bang came up with a prototype idea that was really feasible and that enabled us to collect a lot of information. And then from the glove design, as we were working more and more on the practicality of using a glove design, we moved to something that looks like this design that this lady is wearing. It is a smartwatch with 3 rings attached, and these rings are detachable. So only when the end user wants to wear the monitoring unit, they can wear, and other times they can just keep wearing the smartwatch, and it will keep collecting the information. Once the end user attaches the ring unit, then both the smartwatch unit and the rings would calibrate, and then the information would be accurate enough. Okay, so at this juncture, I would like to stop and tell you why we didn't just go for a wristwatch, because we anyway have a wristwatch design now. Well, the answer is, though wristwatches are very popular, the wrist is not a medically appropriate site to collect information. A lot of information that is collected from the wrist is actually generalized. Different kinds of algorithms work to give relevant information. It's not the direct information from the human body. Okay, so there is a lot of issues with the wrist. It is bony. The skin is not of the right quality, and this is just not the area through which the veins pass, and hence the resolution of the data is not very reliable for medical information. On the other hand, the information from the hand is actually very accurate. It's medically proven to be accurate. So what we do is today we take data from both the hand as well as from the wrist, and we can calibrate. So that enables us to provide very, very accurate information to our end users. And from this wrist unit, we ended up with a ring. So the journey has been like this, as you can imagine. It's been from here, where at this stage, the goal was to create a device that could provide complementary information to that of an EEG. And then it moved to this particular glove. It moved to this particular design that you have with the lady. And then it is moving into the form of a ring. So the journey from that from the clunky glove to a ring has been a huge learning experience for us. As you can imagine, there has been learnings in terms of usability, in terms of practicality, in terms of actually bringing down the size of the hardware and putting everything in a small unit, and also about doing different kinds of experiments with the data resolution and things like that. So the entire journey has been very, very enriching, and we were able to learn a lot in this exercise. So this is the beginning, right? So when I started off, the goal was to come up with a solution that might provide predictions about an incoming attack and might help us to abort an attack or provide emergency care to the person suffering from seizures. But today, that entire concept has moved to not just provide predictions about epilepsy, but also to monitor the end user at their home, outside, or at any given point in time. Of course, predictions is a part and parcel of what we do. So we provide two kinds of prediction. One is about the predictions of an actual event that is going to happen, and then the other is a prediction about the probability of something happening. So which means that we may end up knowing that someone is about to have a cardiac event after a couple of hours, or leading to a seizure, or vice versa. And that probability might be quite strong. We might be able to provide the notification, and the end users, whatever issues the end user was going through, that could be aborted with the help of medical help. Apart from predictions, we could also provide interventions. There are emergency medicines available that could be given, and these severe kind of events could be aborted. And because we gather so much information from end users, we do so in milliseconds, we could provide customized care to the end users. So we get to know their triggers, we get to understand what brings on the stressors for them, what makes them stressed, or what leads to a negative event. We also get to understand what brings down these negative events and how long do they sustain in such recovered periods of time. So all of this kind of information could be collected, has been collected, and we have proven that we could do predictive monitoring. And by doing predictive monitoring, we could help the end user get into a faster state of recovery. So this journey, from not wanting to be a startup entrepreneur to actually becoming one, and from trying to find a solution just for my son to finding a solution that will benefit humanity at large, like I said before, has been a huge learning experience for us. In terms of design, there has been certain things that we have implemented, and just the top couple of them I want to talk to you about. The first one that has tremendously helped me to come this far has been our focus on evidence, creating an evidence-based solution. Now, there could be in the audience, there could be people who might be wanting to start your own company. So if you're thinking about this, I would say congratulations. You're very brave, and my best wishes and blessings would always be with you. However, to ensure that you are successful, if you could look at a way in which you could provide evidence for your solution, evidence for the need of your solution, evidence for the quality of your solution, along the way, the chances of your solution being successful and being used by end users would be very high. Okay, so that's been one of my let's call it tricks, where I have been very adamant in asking the right clinical questions, proposing solutions, gathering evidence around that solution, assessing that evidence, and finally applying that evidence in a solution that is fit to go to market. Now, to give you an example, when I say ask a clinical question, so my clinical question was, how can we abort a seizure when it is happening? How can we predict a seizure event? Right? So we had very specific questions for which I was looking for specific solutions. So I found the solutions which was based on IoT and AI. Then initially what I had was a theoretical solution. So I worked with NIMHANS, National Institute of Mental Health and Neurosciences in Bangalore, which is Asia's premier institute for neurosciences, and worked with them for 3 years to build our solutions. So we had deployed people there day in and day out. Literally, our technicians stayed, our researchers stayed with the end users throughout the night even, and we collected information from the end users. So as designers, you might be aware of contextual inquiry. Contextual inquiry was something which we which we did through and through. So we really observed our end users at their environments, collected every single bit of information about them, and used this huge amount of information. It was like really like every millisecond we collect information. So every 1 minute we get about 6,000, imagine if it is in rows, 6,000 rows of data into several thousand columns. Imagine the size of the data. And so we collected that information, that amount of information every day for 2 or 3 years. So we got that information and then we assessed the evidence. So it's not that we just collected the data and we started building models. No, we had our hypothesis, we created our models, and every time we built a model, I went ahead and tested it with the new data that we collected. And by the end of this 3.5 years, we have a very strong body of knowledge and evidence that says that TerraBlue with their so-and-so algorithms are able to predict seizures or to able to identify seizures using a very small wearable device. And because we've successfully crossed the 4th stage, we are currently working to now apply this evidence in a real world setting. We are now getting ready to go to market. So this has been a tremendous learning for me. And I would really encourage all new entrepreneurs out there to follow a process that enables you to ask the right questions and move all the way up to applying the evidence. The next thing that, the next principle that I focused on was on the practicality of the solution. As designers, even in my career, I have proposed or come across solutions, not just design solutions, but also software solutions, architecture solutions, different kinds of solutions that are quite feasible. They are doable, and they fall within the right budget, and they are for the right audience. So everything is in place, but one key element could be missing, and that could be the practicality of the solution. You see, when I started off with a glove design, it was a great idea. Everybody said that it's a great idea. You have a lot of real estate to plug in the sensors, and it's going to just work very great. But when we were working with the end users, one thing that came to my mind, which I had missed out, though I had seen that thing with my son several times. What I had missed out was that the hand is the place where cannulas, these devices where you put the injection, these are placed when a person is admitted into the hospital, which means that if we have a glove design, a design that covers the upper part of the hand, then the doctors might not be able to put in a cannula at an important time, right? So at that time, they would have to remove the device, which might actually be life-saving for the patient, because doctors would have been able to monitor everything about them. But because the glove was covering the upper part of the hand where the cannula would be put, it had to be removed. The glove had to be removed, and which means that the doctors would not be able to monitor the patient at the most important time, right? So that was an eye opener for me, and that's when I thought that yes, the glove gives us a lot of real estate, and it's great. However, it is not practical from a clinical point of view. And therefore, I started thinking of this kind of a concept where there could be a smart watch or a smart band, and then there could be detachable units, so that a lot of space around the hand, on the upper part of the hand, could be freed up. So the next thing that I implemented was modularity. So every single part of our software solution, the AI solution, could be broken up, and each one of those solutions are complete in their own way. So because they are all modular in structure, and from day one everything has been planned in a very modular fashion, we can build multiple solutions out of the reservoir of code or reservoir of tools that we have, just like Lego bricks. So if you have a whole bunch of Lego bricks, you can do a lot of things with the same set. Similar to the Lego concept, our code architecture is done in such a way that everything could be dismantled and could be built into something new. And this is something that we adopted from day one. All the principles that I'm talking about now, these I had adopted from day one, and they have proven to be immensely helpful today. So remember that, when you're building a product, if you could figure out ways to make things into smaller blocks and then figure out ways to integrate them, that might end up being a better solution than having a big piece of code or big piece of design in one shot. The other thing which is related is extensibility. And so imagine that you're using the Lego bricks to create a house, but then you could extend what's inside and outside the house with the same set of Lego bricks. So you could build a car, you could even build a gramophone, you could even build a ship, a telephone, a gate, and whatnot, right? So it's the same set of tools, and with the same set, you are creating different kinds of structures that are related to the original plan, which is the house. In the case of Lego, we wanted to build a house and then we ended up building all the things around it. In the case of our software, I started off trying to predict epilepsy, but the initial planning was done in such a way that if required, we could extend our solution, epileptic solutions, for other predictive events. At the time when I started, I was not sure what those things could be, but the design was done in such a way that it could be extended into other things. And because of that foresight, from TJay, which is our epilepsy product, we were able to build an even more powerful product called Shant, which is the world's first device for objective management of mental health. It is a device that understands states of mind, and it works in this way. Suppose the audience was wearing our device and I'm speaking to them. I could actually see how the audience are feeling. And based on whether the audience is liking my talk or not, I could change the structure of my delivery. So it's that kind of a device. And till Shant, the only way to diagnose mental health was through pen and paper. So psychiatrists and psychologists would use pen and paper, which they call tools, to ask different questions and then come up with a diagnosis. A proper diagnosis for mental health, for a depression, would take probably about 1.5 years. With our device, in 15 minutes, the doctor would get to know if somebody has any kind of an anxiety or mood disorder. So it's a very powerful device that we are hoping will become a game changer. And every household would have it one day, just like every household today has a thermometer. Every household can have a device to measure the state of one's mind. So this thought to create Shant was definitely not there when I started TJay. But because we thought of creating our product in a very scalable manner, in a very modular manner, we were able to extend it to related diseases and disorders. One of the last things that I had to grapple with throughout this entire journey was balancing form and function. On the left-hand side, what you see is a proper EEG system. As you can see, it's pretty big. And of course, there are the electrodes that would be put on people's heads. So the electrodes are currently not shown in this image, but this is how this entire system looks like. And we are competing with this system with something that is as tiny as a ring. So imagine the amount of engineering that would get into trying to somehow come up with similar kind of functionalities like that of an EEG system, and in a form which is acceptable to end users. So this was something that we had to grapple with a lot. And I tried to solve this problem by prioritizing on the features. So of course, the EEG device has its own, list of advantages and disadvantages. So when we were creating our device, I thought that, we cannot obviously compete with everything, but can we prioritize on what's most important? Can we prioritize on predictions? Because this is not something that an EEG system does. It is not built to give predictions. It is built for detection. So can we build for prediction? And maybe detection comes as part of that. Can we just do that? Apart from this, the EEG device has several other top features, Can we ignore those features? That's what I thought. Can we just ignore those features, go for one or two very basic, very powerful features, and can we build around that in a format which is acceptable to people that are going to wear it? So balancing of the form and function is important. When I was building, people were also telling me that, why don't you focus on the wrist? It's very important to focus on the wrist. because people are used to it. As usability folks, you would understand that once end users get used to a system, they are very reluctant to move to a new system. So I was told over and over again that please focus on the wrist, forget about the hand, because nobody would want to have anything seen on hands because of the stigma, etc., that is associated with disorders like this. So focus on the wrist. But I also had to take the call of not just focusing on the wrist, because I knew as a builder, I knew that getting information from the wrist would be cheating my end user. And at the beginning of the presentation, I shared that what's not good for my family is not good for others as well. So going by that principle, I thought that well, I understand the emotions around having something on the wrist versus the hand, but can we come up with a system where we can use both without really compromising on the function? And from that thought process, I came up with this thought about having a detachable ring system attached to a smartwatch. So that was it really took some time and effort, and today it looks like a very simple piece of hardware, but at the time when I was building it was one of the biggest thing that I had to work with. So I have come to the end of my presentation, and I want to leave you with a parting shot. So this is personal in the sense that, I've already said that when I started this journey, my goal was not to start a company. I was looking for a solution for my son's problem, which was very severe and very serious in nature. As a mother and as a caregiver, I was under tremendous stress. And my only goal was to somehow ensure the safety of my son. And the situation was so bad that I myself went through severe anxiety, I went through depression, and I had to be hospitalized and ironically put in an ICU because my situation was so bad. I was getting severe panic attacks, and I didn't know how to deal with any of these situations. I decided to focus all my energies into not worrying about my, the effect that epilepsy was having on my son. I tried to move from that sort of a thought process to moving into what can I do to make things better for him. This shift in thought, that the one side it was about, oh, my son is going through a bad time, what is happening to him, doctors are not able to help him, I don't know what I'm going to do, I don't want to lose him, etc. So that was one kind of a thought that was there. On the other hand, there was also this thought ki, fine, he's got epilepsy now, so there is no way we can stop it, but can we make it better? Can we make the knowledge that if I had, as a parent, if I had known earlier, or if the doctors had known earlier, this boy would have been a normal boy. Now, can I take that thought, that bit of information that I heard, can I take that and build something which will not be beneficial to my son probably, but which will ensure that another child or another human being does not go through the same trauma. I decided to go for the letter, and that's where my healing as a parent started. Today, my son is a special child, and I'm very proud of him. I don't want him to turn into anything else today. So he's meant to be what he is in the shape and form he is, and I respect that. And that's what I want from him. And as I worked on this technology, on this company, and on the other hand, I see my son, I realized that this company has come about only because of him. If he was not there today, if epilepsy had not happened to him, I would have continued with my life. And this amazing company called Terra Blue would have not come to the world. And with its absence, the products like TJay and Shunt would have never been even conceptualized. So that realization is something that stays with me every day. And I want to communicate to all of you that in life, as designers, as individuals, as technologies, etc., we will come across many of these very debilitating situations that will really bring us down. But if we can remember that healing is a choice, it's a choice that we could make. Either choose to stay in the negative, continuously procrastinate and think how things have gone wrong, or we can make something completely different out of that entire thing. Then life would become very, very meaningful. And with that, I would like to thank you, and I would be happy to take your questions. You can reach out to me in LinkedIn, or you can write to me or call me, and we'll be happy to talk.